about 12:01, so we'll go ahead and get started with our July Plan4Health Nutrition Peer Call. This is Elizabeth Hardig from APA, and I see we've got a nice group of folks on the line, lots of members of Cohort 2, and then, of course, some names that I'm not too familiar with, so you might be from APA's Healthy Communities Interest Group, so welcome to the call. If you're not well-versed in all things Plan4Health, I did put a link to our website up in the chat box. So we do have 35 coalitions working across the country in 2 cohorts. Cohort 1 wrapped up around May. They've got lots of great resources and final reports that they've shared with us available on the website. And then Cohort 2 is just about hitting the halfway point, as hard as that is to believe. And we've got 17 sites who are well underway with their projects right now. So as you know, we always have a physical activity peer call and a nutrition peer call, and this is our nutrition conversation for the month, and we're so excited to have Karen Banks with us. So as you can tell from this opening slide, Karen is with Johns Hopkins Center for a Livable Future. And for those of you on the line who were with us at our Baltimore Plan4Health regional meeting, we actually spoke with Ann Palmer, who's Karen Banks' colleague, so continuing the Center for a Livable Future trend. So Karen is a senior program officer with the center and really works with food policy networks, again, as you can see from the slide, but has lots of great experience both in food systems and planning and public health. And so we're just so excited to have her here today to share a little bit more about her work and the resources available at Johns Hopkins, but also just to have a conversation with us about food systems and community engagement and community gardens and corner stores and all of the great stuff you're all working on. So I'm going to hand things over to Karen to kick us off with a little bit of just information and resources, but don't hesitate to pipe up and chat with us over the line or to send in questions. Either way, we'd love to hear what you're thinking and have a bit of a conversation today. So thanks again for joining us, Karen, and I will hand things over to you.
Thank you, Elizabeth, and thank you to everyone else for inviting me to be here to chat with you this afternoon. I prepared a few slides just to go over what we do at the Center for a Livable Future and to give you some background information on the food policy networks and our work with food policy councils across the U.S., and then to introduce you to some resources that we have that are publicly available to anyone that has an interest in food policy. So the Johns Hopkins Center for a Livable Future focuses on, we work at the intersection of diet, food production, the environment, and public health. We are a research center, but we also provide technical assistance and technical expertise on issues. We do research. We also work with partners across the organization, across the nation to address food systems issues. So we're more than just a research facility. We do provide technical assistance, and we work to translate some of that research for a wide variety of audiences to make it more approachable to those that are working in the field. The Food Policy Networks project is part of the Food Communities and Public Health program within the center, and the Food Policy Networks program was started in April of 2013, and it's an extension of what was originally the Community Food Security Coalition work around food policy with Mark Winnie. He had a list of food policy councils that he was working with, and once the Community Food Security Coalition disbanded, was looking for a home to situate that network, and it came to the Center for a Livable Future. So we've taken on some of the work with him. He's a senior advisor with the Food Policy Networks program and have expanded it. So we work directly with food policy councils both in the United States and in Canada. And our role really is to provide technical assistance, to be kind of a networker and connector. Ann Palmer calls us a bridge builder, connecting food policy councils with each other, with other organizations working on issues of food policy at local, state, regional, federal, and tribal levels. And also we share information and kind of track best practices, as well as conduct some research on what's working well within the arena of food policy and with food policy councils. So what is food policy and what do we mean by food policy? We have a pretty loose definition of what we define as food policy. We're not strictly talking about government regulations or laws. We also look at institutional policy, so what's happening within organizations like schools. What are the policies that relate to food in schools or within businesses? So it's a broad range in terms of what we address around food policy, but we do we try and work at all of those different levels, both administrative, regulatory, and institutional, helping councils to work through what some of the issues are, what the levers are that they can pull on to change policy to improve the food system. So a food policy council is a group of stakeholders from multiple sectors that come together with a shared common interest and try to align their values on a shared agenda to improve their food system in their region. The councils, there are around 280 in the U.S. and North America and Canada, and they range in terms of size, they range in terms of area of focus. There is not one size that fits all model for a food policy council, and often the names of food policy councils may not include the word policy in their name because that can be a sensitive term depending on the political environment that you're working in. So we see them called healthy living, active task forces, or we hear them called coalitions, work groups. They may be a work group of a mayor's office or within a local government as well. So the breadth of names and the structures of councils varies across the United States. And so we work with councils to learn from them as well, to understand what structures are working within communities. So what do food policy councils do? They function as a body of stakeholders bringing together a common shared agenda. They can work on systems planning within a local community, maybe working with their local government planning department or their health department to address some issues around public health or around urban agriculture. They also work to elevate the voice of community members, so trying to be that body that can bring together community members to work on issues and to elevate a lot of their concerns or elevate their power in terms of influencing policy change. So food policy councils work on a variety of issues from food production to food waste, also around food workers. There isn't one issue that policy councils are all addressing. Every year we survey the directory of councils that we know of, and are always looking to hear if there are new councils emerging in locations, trying to find out what are the issues that are resonating or trending across the nation so that we can make sure that we have resources that are appropriate for those councils and also to understand what issues they're facing. So below is a short list of issues or sections of the food system that councils are addressing, and then below is a chart from last year showing the issue areas that councils are focused on and what their priority policies are. You will see that healthy food access is a big issue for councils and something that they're working on and trying to figure out, how do you improve access to healthy foods, not only within retail environments, but also through transportation as well or at farmers markets. And another one that we see that's increasing slowly with the interest in is food waste. Since 2013, we've been conducting this survey, and food waste has been one that is not necessarily on the agenda of all food policy councils, but continues to rise and interest continues to grow. So to provide you with some examples of what food policy councils are working on, I focused on two areas that are big and we see a lot of activity behind. One is urban agriculture, and the other one is healthy food access. Urban agriculture is an issue that councils address both in terms of changing their city zoning codes to include the ability for community gardeners or for home gardeners to sell the produce that they raise within their gardens at a farmer's market or at a farm stand within their community. Another way that councils address urban agriculture is by including bees, so being able to raise bees in a backyard, or chickens, be able to host chickens in your backyard, or to be able to allow for hoop houses without having to get a permit to have a structure within an urban farm. So the city of Baltimore, one of their initiatives of their food policy initiative was to change their urban agriculture zoning code to allow for animal husbandry and also to allow for hoop houses without a building permit. The city of Pittsburgh recently was successfully changed their city code to allow for the sale of produce from urban farms or urban gardens. And with that, they produced a guide that's available on their website to help gardeners or farmers navigate the code and understand what they need to do in order to be compliant with the changes in the code. Other councils are working to address healthy food retail. We see a lot of interest in healthy food financing initiatives. The Madison Food Policy Council was able to leverage funding from the city government for a healthy food retail access program. And that access initiatives that they were funding included bus routes or getting reimbursement for a bus that would take people from a residential housing unit to a grocery store. So they have some criteria, and organizations are allowed to apply to receive that funding. From that, the City of Madison has since provided funding to support new grocery retail in targeted areas that they have mapped out kind of where their food deserts are, or what they call food access improvement areas. So those are a few examples of policies that councils are working on. Again, there are a lot more that they've been diving into, and we try to capture those within our directory. So the Food Policy Networks program has a number of resources that are publicly available, which you all can go and access and find information. One is we have a resource database that has over 900 resources. Those resources focus on coalition building, organizational development, community engagement and inclusion. They also focus on topic issues for food policy councils, so urban agriculture zoning ordinances or healthy food financing retail policies. We try to capture as many of those that we see come through and include them in the database as well. Our database is set up so that you can search it using keywords, and also there's a series of filters that you can use to pare down the search results. In addition to these resources produced by councils or that provide guidance to councils, we also include what are called food policy FAQs, or frequently asked questions, and we develop these based on questions that are posed to our listserv for food policy councils, capturing some of the nuances and some of the details around what councils are doing. So we run a listserv that's open to anyone to join that has an interest in food policy, and it's meant to be a way to share resources and also to ask questions. And oftentimes councils will pose a question around an issue that they're working on and try to get guidance from others working in the field to learn what's happening across the nation. And we collect those responses and we put them into a FAQ that then gets posted in our database. We have also a directory of all of the food policy councils across the nation. Like I said, we survey councils once a year and collect information, contact information, as well as understanding of what policy priorities are, technical assistance needs, and what are achievements, what successes are councils seeing. Some of this information gets posted into the directory so that if you're looking for if there's a council in your city, county, or state, you can go to this directory and search by state to see what councils reside in your community and what they're working on. And lastly, we have a listserv. And I apologize, that picture is very bizarre. We have a slider and it overlaid all of them, so they come through pretty awkwardly. But we have a listserv that has 1,100 members. You're welcome to join the listserv. We moderate the listserv, so not everything gets posted. If there's an out-of-office response that comes through, we do not post that to the listserv. But again, it's a way to share information, share resources, ask questions, and learn about what's happening with food policy councils across North America. And with that, I'm going to open it up for questions from you.
Great. Well, thank you, Karen. And I don't know if you planned this or not, but Katie Haas from Eagle County is part of Plan4Health Cohort 2, so that was a wonderful plug for their work. She was on the directory slide there. And I do have to let folks know the listserv is one of my favorites. I joined maybe a couple of years ago now, and I learn 5 new things every week through that listserv. It's really, really fabulous. So thank you for curating that and having that just be open and available to folks.
Thanks for being a member.
Sure. So feel free, if you're on the line, to unmute your phone and chat a question or share a question directly with Karen, or you're also welcome to use the chat box on the right-hand side of your screen. And while folks are thinking about their questions and kind of digesting all this great information, I did want to get back to the point you made about language, and not every food policy council uses the word policy, and I think that's really interesting. And we were on a call last week with one of our coalitions in Cohort 2 who made that same point and reminded us that I've forgotten the exact name of their council, but it is policy is nowhere near it, and it's much broader term that's really thinking about all of the food system issues for that community. So that was an interesting point you made, and a good reminder to us about language and accessibility, and recognizing that some words just don't quite perhaps mean what we all hope they mean to some of our stakeholders. So thanks for sharing that.
Sure. It's a conversation that we have on a regular basis because we work across the U.S. on issues within the food system, and rural areas address food systems issues differently than urban areas. And so we're still learning about kind of what are the best strategies for framing messages. And it's a question that or an area of interest that we see within councils and also within our Listserv. We surveyed our Listserv last year at the end of the year to understand how people are using it and what their interest is. And one of the themes that came out was around communication and framing, particularly when you're talking to a local government or in a rural area. How do you talk about health issues so that it's not disparaging or so that it addresses the thoughts of communities that may be looking at health from a different lens, and particularly in rural areas.
That's very interesting. Well, we did receive one question prior to the call, so I'll go ahead and share that while folks are thinking through their own lists. So one of our coalitions is working on community gardens, and I know you mentioned city zoning as or another resource that's part of the center and another way for folks to expand selling produce and other opportunities. This particular question was really focused on engaging community members in the maintenance of the garden and really creating a space that is welcoming and open. And just wondering if you had any recommendations about almost like guidelines that could be posted, or maybe having a community meeting to kind of talk through how the garden would potentially function for that particular neighborhood. Do you have any thoughts about that, or have you heard of examples from across the country of folks who really are trying to make the space very intentionally open and have this sense of shared ownership?
Sure. So we don't get down enough to that level of engaging community within a certain kind of program like a community garden. But what we do and what we have resources about is within a council or a food policy council, how do you build inclusion of community and represent all of the voices? We had a student that worked with the Center for a Livable Future. Her thesis was around inclusion and diversity within food policy councils, and so we've taken that information and produced a guide on how can food policy councils further engage community members in the conversation and what are some best practices and examples that they've seen. And it ranges from hosting a gathering or a movie night that invites the community to learn more about what the food system is and what are some of the issues that food systems are a community is facing around the food system, and maybe show a movie or documentary. Other examples include providing a stipend to those that may be of lower income to help them to be able to attend a meeting, or providing childcare so that it ensures that they can participate. One of my former jobs in a prior life was working with community gardeners in Austin, Texas. And it was an issue that we addressed or were facing a lot, was how do you include, make sure that you have a diverse and inclusive group that's participating in the community garden, particularly in Austin, where we were facing a lot of issues of gentrification. And so community gardens were seen as this first wave of gentrification, bringing in a group that may have an interest in food and kind of this foodie culture, but not recognizing the families that had been there for generations and their background in agriculture. And so some of our community gardens were very much intentionally promoting kind of the work of their members and talking. We had a large refugee group that was participating, and so there was a focus on making sure that they were included, reaching out to them and communicating with them directly. So there are some examples. I'm not sure within our resource database if we have a list of the policies of community gardens, but that would be a perfect question to pose to the Listserv to ask if food policy councils have seen guidelines of community gardens that really do stress inclusion and diversity. I know that we have some guidelines from food policy councils of language that they use, to make sure that they're promoting diversity within their councils.
That's great. Thank you. We had a peer conversation a couple of months ago where one of our coalitions from Cohort 2 talked a little bit about their guidelines for the overall coalition, and it sounds like there's definitely some overlap between their structure and work and what you're describing. It's available on the database, and other councils have thought through. So that's a great resource. Thank you so much. So another question that's come up within the overall Plan4Health work has been around the retail side of things. Some folks have thought about healthy corner store options or expanding farmers markets, or there's even been a little bit of a mini trend, I would say, in Plan4Health of pop-up farmers market or things that are kind of happening over the summer months. And I just wondered if you had if you're noticing anything that food policy councils are talking about in terms of kind of the retail aspect, or if you have heard of a wonderful success story around a healthy corner store initiative or a healthy, even a chain store. Of course, our dream, right, to be able to really convert an entire, beyond one particular site, but really a whole group of small grocers would be fabulous. I just wondered if you had any success stories that came to mind or anything that you've heard from other folks around the retail side.
So within the retail side of healthy food access, we see councils working in kind of two main veins. One is leveraging city funding and private funding to incentivize stores in underserved areas. So the Food Trust in Philadelphia, I think, was kind of the main driver behind with their work with healthy food financing and working on local and state initiatives to provide funding around incentivizing retail to move into or build sites in underserved areas. The other vein that we see councils working in is around farmers markets and ensuring that vendors are able to accept EBT for the SNAP program or for food stamps and also for WIC farmers market vouchers. So that's a big push, and along that kind of effort comes the Double Dollar program. So making sure that federal benefit recipients are able to use their benefits at farmers markets, and in addition providing an additional incentive of sometimes up to $10 for those participants to spend on fruits and vegetables at a farmers market. And we see a lot of work around that connection between SNAP and farmers markets, and also a little bit with WIC. And then in the healthy food financing arena, Baltimore City's been very successful in some of the efforts that they've made around leveraging funding for grocery stores to move into underserved areas. And they're undergoing an initiative right now with their economic development department where they offer not financing, but they offer a tax credit for businesses that want to locate in an underserved area. In terms of the evaluation or success stories, these programs are fairly new. I would say that the most success has been seen in Philadelphia, although we are following, with help from the National Conference on State Legislatures. They recently released a report around what are the trends in local food legislation across states, and so they have documented the legislation that's coming out of states providing financing for these initiatives. And so understanding where it is being offered, and then we're looking at kind of how do we evaluate these programs because there's an interest, but there hasn't been a lot of evaluation done yet around the impact of the programs.
Mm-hmm. That's great, and I hear you on that. I think that's one of our discoveries in Plan4Health. We have a lot of wonderful, innovative strategies that we feel have wonderful potential and possible. The impact is going to be fabulous, but we have not been able to completely evaluate things, and are hoping as we continue to move forward the conversation of planning and public health, we'll get some of those numbers back and really let folks know that this type of work makes an incredible impact on creating healthier communities. And thank you for mentioning the Double Bucks program. It's at APA's conference in Seattle, we had a mobile workshop to visit a farmer's market out there where they were talking about the Double Bucks program. They'd launched it about a year before, and it had wonderful success. And it was one of those rare sunny days in Seattle, so we actually had a chance to walk around the farmer's market and talk a little bit about that particular program before checking out a local food hub, which was a little bit outside of the city, but another way that Seattle was thinking about their overall food system and really getting at some of the issues you mentioned earlier in Austin. You know, you've got these wonderful people who are excited about food and foodies, and then you also have community members who've been around a bit longer, and perhaps there's some tension there, and it was interesting to see how Seattle was approaching that particular challenge and all the different ways that they're celebrating food and really thinking about increasing food access. So we just have a few minutes left if other folks have questions or comments, or if they'd like to share a little bit about their projects with Karen as well, but you're certainly welcome to do that. And I know some folks are still kind of deciding on which strategies they might be tackling in the nutrition area. So in the Plan4Health cohort 2, we've got some sites that are more established and really diving into their PSE improvements, but we also have some folks who are on the capacity building, more emerging side, who are still working through some assessments and trying to figure out what makes the most sense for the community right now and what intervention might be appealing. They might get some traction. So certainly if you're still in the assessment phase, you're welcome to just share some initial thoughts or what you might like to try in the next few months.
We have a lot of information that's probably not on our website. So if there are members that are looking for examples and have a specific question about what in the realm of nutrition or healthy food access that they're looking at or considering, we're happy to help pull examples from our list, from the directory and from the survey, and from what we know that are happening with councils as well. There's a lot more that probably we don't know about still, and so it's also a learning opportunity for us because every community does things a little bit differently.
Mm-hmm. That is very true. Every community is certainly unique within Plan4Health and elsewhere. It's been great to see how the general framework has been adapted depending on the geographic area or the needs of the community. Thank you, Karen, for that offer. All right. Oh, we do have one final question. So ideas or suggestions on how best to fundraise or identify funding for the Double Bucks program? Oh, that's a great question.
It is a great question, and funding is always the linchpin.
Right.
We recently wrote a brief on the SNAP program, how the SNAP program functions, and then how councils, food policy councils, can engage at different levels. And we provided some examples of how councils are working with their communities on SNAP. And there's a lot of work, like I said, around SNAP and farmers markets. And one of the councils in Massachusetts has been working with a group of farmers markets and then another health and fitness organization, and they do a creative, it's a crowd, they call it crowdfunding. So they've launched a campaign that they run every year, and it's a social media crowdsourcing campaign to raise money to support their Double Bucks program. So they're looking outside of the traditional kind of sources, looking outside of kind of asking your county government, your local government, but really going more broadly. So they're reaching out to individuals and also to organizations and to foundations as well, and they do some grant writing collectively also, but I thought it was pretty unique that they were using this notion of social media and crowdsourcing to raise money for their Double Bucks program.
Yeah, that's really interesting. I have not heard that. That's exciting, and another way to think about engagement and kind of a fun fundraising activity. One of our coalitions in Cohort 1 ended up putting together a grant writing subcommittee of the coalition to think about not just Double Bucks programs specifically, of course, but generally to have a structure that's part of their ongoing coalition work that thinks about a group of folks who are thinking about fundraising and kind of other ways to identify sources, which has been nice to have that standing committee. I think we all know volunteers change and we move to different positions in our own organizations, and to have some continuity around the funding question was a great move for them. And of course, they secured a Plan4Health grant, so they were very excited. Nothing like a little positive reinforcement.
That's great. And another opportunity to consider is through community hospitals and healthcare. With I'm going to butcher this, the community health needs assessments that are required of nonprofit hospitals. They're looking more at prevention and ways to be required to provide preventative actions. And so seeing if there's opportunities working with healthcare industry to provide funding for double dollars programs or for veggie prescriptions might be another avenue to explore.
Oh, that's a great idea. That is very true. Well, great. Well, Karen, you have covered the entire food system in 30 minutes. This has been really fabulous, and thank you so much for your time and sharing your resources. And again, to folks who are on the line, the Listserv is really fabulous, and the database is also just a wonderful source of information. So thank you so much, Karen, and I look forward to speaking with all of you soon.
Thank you. I enjoyed it.
Have a good afternoon.